Tips for lasting longer in bed. According to surveys, people want sex to last longer than the average of 5.7 minutes, with desired duration ranging from 7 to 13 minutes. There is evidence to suggest that premature ejaculation may be caused by abnormal transmission of serotonin in the brain. Some tips to last longer in bed. Use more foreplay. If you're worried about your partner's satisfaction, adding in or increasing foreplay is a good strategy. Switching to sex positions they enjoy, or upping your communication to discover new ones together, is another tactic. This is especially true for heterosexual couples, since there tends to be a gap between how long it takes men and women to finish. While everyone is different, in general, women require direct clitoral stimulation to orgasm, and often find it more difficult to finish from penetrative sex alone, since the clitoris doesn't come into direct contact with the penis during penetrative sex. One survey of over 50,000 people found that just 18% of women reported experiencing an orgasm from vaginal penetration. Starting with fingerplay, oral sex, or asking your partner what they love is a great way to bridge the orgasm gap and improve sexual satisfaction to ensure that you last long enough for both of you to enjoy sex. Try edging. Edging can help extend the time it takes to orgasm, though it takes some practice to get right. What is edging, you ask? This technique is when you get very close to ejaculation, but then stop until the feeling has passed. These pauses can calm things down and keep your sex session lasting longer. There are a few different methods for edging. You can try the stop-start method, which is when you pause sex or masturbation until you no longer feel like you're going to finish. There is also the squeeze technique, where you or a partner squeezes the head of your penis until you feel like you can keep going. Bring sex toys into the bedroom. If there's a gap between when you finish and when your partner does, using a toy they like can help close the gap. The great thing about sex toys is the endless variety. You can try using a vibrator during sex or foreplay to focus on getting your partner to that sweet spot faster. Masturbate before sex. This option may take some experimentation to get right. Try to find a time for masturbation close enough to sex so you're not too worked up before it starts, but that still leaves enough time for you to get excited and enjoy sex as you should. Use thicker condoms. Thicker condoms create a more significant barrier, which may decrease the intensity of sensation during sex. If what you're feeling is less intense than usual, it could take you longer to ejaculate. That's why thicker condoms are commonly marketed for extended pleasure. Explore different sex positions. There's a reason they say variety is the spice of life. Adopting that motto in the bedroom can help you last longer in bed. Things necessarily slow down, if only for a moment, when you change sex positions, which may help bring you back from that point of no return. Plus, different positions can be more or less stimulating for you or your partner, and you might discover a new favorite position or two. Strengthen your pelvic floor muscles. There is a physical component to pee that historically hasn't gotten much attention. Those would be your pelvic floor muscles, and strengthening them could help improve pee. Kegels are a good pelvic floor exercise and aren't just for women. To perform Kegels, focus on lifting and pulling in your pelvic floor without using your back or butt muscles to help. Squeeze the muscles down there like you're trying to hold in pee or prevent yourself from passing gas. That squeeze you feel is your pelvic floor muscles contracting. Repeat that squeeze 10 to 15 times, holding each for 3 seconds and relaxing for 3. Do this at least 3 times every day. It's okay if you can't do a full set of 15 Kegels on your first day. Keep at it and work your way up. Consider weight management if you have overweight. Studies have documented a link between premature ejaculation and metabolic syndrome, which refers to a cluster of health conditions often associated with overweight and obesity. These include abdominal obesity, high blood pressure, high blood sugar levels, prediabetes and diabetes, high blood triglycerides or bad cholesterol, low HDL, or good cholesterol. In one study, people with metabolic syndrome were twice as likely to have premature ejaculation. If you have obesity, getting in better shape and losing weight may help you last longer in bed, with the added plus of giving you more sexual stamina. Quitting smoking and exercising more have also been shown to improve erectile function. Drink more coffee. If you don't drink coffee, now might be a good time to start. One small study found that drinking 100 mg of caffeine, or about 1 cup of strong coffee, 2 hours before intercourse helped participants last much longer during sex before ejaculating. Avoid overdoing it with caffeine though. Experts say 400 mg of caffeine is a safe amount to have daily. Go above that, and you might experience unfavorable side effects like an increased heart rate. If coffee isn't your thing, there are other drinks that can help you last longer in bed. Consider medication. Prescription medication may be necessary to treat PE for some people. Although there are no FDA-approved medications specifically for PE, some providers prescribe PDE5 inhibitors. These include popular erectile dysfunction drugs like sildenafil brand name Viagra. You may also be recommended antidepressants like selective serotonin reuptake inhibitors as an off-label treatment. Look into adult circumcision. Circumcision may feel like an extreme option, but it has merit, according to one study of over 1,000 men with premature ejaculation. Participants were split into 2 groups, and one group underwent adult circumcision removal of the penis foreskin. At a 1-year follow-up, the group that got circumcised reported being able to last longer during sex, with better control over when they ejaculated and improved satisfaction with the sex they were having. However, other researchers have found conflicting results indicating that a foreskin might actually help you last longer, so more research needs to be done in this area. Talk to a therapist. If lifestyle changes don't seem to be helping you last longer in bed, consider talking to a therapist. For some men, underlying mental health issues like stress, anxiety, and depression can prevent them from lasting as long as they would like to during sex. And premature ejaculation can only add to that stress and anxiety. Working with a psychotherapist can help you get back control over your mental health, which can make life easier and sex more enjoyable. If the cause is something physical, a certified sex therapist can guide you on techniques such as biofeedback, visualizations, cognitive distraction, and others that can help you last longer in bed.